Getting to look at the concept of lipodystrophy. Concept of lipodystrophy is quite an interesting one. So I got to know about lipodystrophy when I was reading about diabetes mellitus. When I was reading about diabetes mellitus, I came across what? Treatment for diabetes mellitus. So I saw a lot of drugs for treating diabetes mellitus, insulin glulicine, different types. Okay. So each of these drugs, when I was reading about their pharmacology, I got to see that their side effect is lipodystrophy. I was like, wow, what is lipodystrophy? Let me come experiment on it. So lipodystrophy is simply what? An abnormal distribution of body fat. Lipo, lipids, dystrophy, scattered. You get? So now there's an abnormal distribution of body fat, and this will lead to what? Cosmetic and metabolic complications in the individual. All right. So what are the types of lipodystrophy? We have the congenital one, which is what? Present at birth. You could have the acquired lipodystrophy, which develops later in life. Okay. You could have the familial lipodystrophy, which is basically what? Inherited. You could have the HIV-associated lipodystrophy, which is related to what? HIV treatment. Okay. So I think the one that is gotten from treating diabetes mellitus will fall under the acquired one. Okay. What are the causes? Could be genetic mutations, could be HIV protease inhibitors, could be insulin therapy. Okay. So you guys, I came across this concept when I was reading about the treatment of what? Diabetes mellitus, which is mostly by man-made insulin. You get? It could be autoimmune disorders, it could be trauma, or injury. Okay. Then looking at the symptoms, yes, there will be loss of subcutaneous fat. That's lipoatrophy. Loss of subcutaneous fat, lipoatrophy. There will be accumulation of fats in unusual areas, which is what? Lipohypertrophy. Like, let me you see from this image. Fat is accumulated here. We're actually losing fat from the thighs. You get? So it's not balanced, right? So there's what? Lipoatrophy, lipohypertrophy. There's insulin resistance. There could be diabetes mellitus. There could be what? Dyslipidemia. There could be hepatic steatosis. For physical exam, okay, for diagnosis, you might want to do physical examination, medical history, laboratory tests, imaging studies, genetic tests. All of that could be helpful. Treatment is still treated by insulin therapy. That's if the patient has a secondary disease of diabetes. Okay. Then metformin, that's if there's insulin resistance. Then lipid lowering medications, hormone replacement therapy, cosmetic surgery, that's lipofilling. Then lifestyle modification, that's when you are doing all those diets, exercise, and stuff. Complications, it could lead to what? Cardiovascular disease, it could lead to what? Pancreatitis, it could lead to hepatic failure, it could lead to what? Osteoporosis, it could lead to mental health issues. Okay, so that's it for lipodystrophy. See you guys pretty soon.